and it's a massive infection built up in my abdomen, essentially. So on May 10th, 14 days after my daughter was born, they brought me in for exploratory surgery. By this time, I had been in the ICU with high fevers. I was delirious. I was not doing well at all. And they told my family they were going to bring me in just for exploratory surgery to see what was going on. When they took me into the OR and they opened me up, they realized that my colon was completely non-viable and ischemic. And they suspect that the weight of the infectious fluid had been sitting on the colon in a way that they had to do an emergency colectomy fluid. So here's what my stomach looked like. I had the ostomy bag, a G-tube, a J-tube, and then 3 more drainage bags. And, you know, Sports Illustrated swimsuit edition kept calling. They wanted me to be on their front cover. And the ER nurse who admitted me looked at me and she said, "Oh my God. In 21 years of nursing, I have never seen anyone who looks like this." Now that is not a prize you want to be bestowed. You really don't want to be that interesting when you're a patient. Said after 2 weeks, you know, we've done another CT scan. We still have not gotten to all the infectious fluid. We don't think we're going to be able to get it out with the drains. We're going to take you back in for another exploratory surgery. So they brought me back in, and when they opened me up, my abdomen was such a disaster that they accidentally hit my splenic artery and I bled out on the operating room table. They had the trauma team and the transplant team stampeding down the hall, and they were really, it was a desperate attempt to save my life. And then several days later, they gave me a tracheotomy. So I spent most of July in the ICU, and I had a tracheotomy, so I couldn't speak. My body deconditioned to the point where I couldn't write or communicate in any way. So I was really locked in mentally. I heard everything. They would be talking sort of like I wasn't in the room at all. They'd be, you know, saying, "Hey, you know, are we going to order Chinese tonight? And, oh, what do you want? I'm going to have the Kung Pao chicken." And I would be lying there, obviously looked like I was completely out of it. And all I was thinking in my head was, I like Kung Pao chicken too! And then there were other nurses who relentlessly dedicated themselves to try to decode my needs. And they would say, blink, you know, blink once if it's a yes, blink twice if it's a no. I had my picture cards with the alphabet, and they would try so hard to figure out what I needed. And that made a huge difference. I would love for doctors and nurses to look the patient in the eye and say, "I know it's so frustrating for you right now that you can't communicate what you need, but I'm going to do my very best to try to figure it out." I think that goes a very, very long way. There's no need to talk louder and slower unless the patient is hearing impaired. They started to try to get me to eat again, and I was able to take maybe 1 or 2 steps there. And then I was transferred to a rehabilitation center in Chicago where they gave me continuous therapy. And finally, on December 1st of 2006, my husband came to pick me up. It was a snowstorm that shut down Chicago, and I just remember thinking, I'm going to die on the way home from the hospital. Because that patients are intelligent human beings, but they don't have your same skill set. Let us then take the situation, bring it to our colleagues, and say, how can we prevent this from happening again? And I think that we need to cultivate that community of safety within the hospital walls, within the doctor's offices, to feel that, you know, you're not going to be looked down upon if you ask a question or if you are uncertain about something. And after the test, the doctor who delivered those results looked at me and she said, "Well, the results are inconclusive, so either you're going to regain feeling in your hand or you're not." And there was no great way to deliver those test results. They were inconclusive, but a little compassion, I think, would have gone a long way. Some of the nurses would try, and they would fluff my pillows and they would arrange me, and they would, you know, do the whole sheet thing where they flip you and move you. That is the art of practicing medicine. I had a doctor tell me that I would probably have a trachea for the rest of my life. And then the next actor that came in said, no, we're going to be pulling it out in 2 weeks. So it's that inconsistent messaging that I received. It was very confusing. And every time someone told me something, I would try to readjust my life trajectory based on it.